I was offered the opportunity to come to Hendrick and learn case management. And I knew that I would be taught the right way to do it. So it was I just couldn't pass it up. I was excited, and it was actually a shift in my career. And I was ready for that. I was ready for the challenge of it, and I was so excited to be here.
So I've been at Hendrick for 5 years. I actually started as a CNA here. So I finished school and went through my major in social work and got my licensing and transitioned over to a social work position. And so I've kind of, what they say, gone up the ladder here at Hendrick.
I just thought it was a time in my career for me to get off of the floor and so much hands-on with the patients, but I still wanted to remain in touch with the patient. So, and as a case manager, you can do that.
I had never really seen myself working in a hospital prior to actually coming here, but I have really enjoyed learning about the medical aspect of social work and working with patients during this time of usually crisis. They didn't plan on coming in here. They don't necessarily want to be in the hospital, but helping them work through that time and figuring out how to keep them safe and hopefully try to keep them out of the hospital has been a joy for me.
I left the bedside after 20 years and went to case management in January of 2009. And it just opened a world to me, a whole new world of nursing I just didn't know existed.
A typical day begins with rush, which is so important. We all get together and have a plan for our patients. And then after that, I triage. I prioritize what I need to do. It's very busy, depending on if I need to get a patient to another hospital. Do I have discharges that I need to tend to? Do I have admissions? Occasionally, I have to start the day with a family meeting. So it varies. It's never boring. It's always something different. It's helping doctors, it's helping the hospital, it's helping the patients' families. We stand at the center of all of that.
I work on 2 different med-surg tele floors, and we have a really great team. We have a charge nurse who knows everything about everything that's going on, who is very willing to help us or put in orders or whatever we need to do. The other nurses are all work well with us. We let them know what we need. They let us know what they need, and we just work together and get it done and get the patient what they need.
As a case manager, we're in constant contact with the patients and their families. And so I feel like it's easy to always deliver that kind of care.
The collaboration is really important because you have to have a relationship not only with your physicians, but with your nursing staff, your charge nurses, your ancillary. Then you are constantly making new relationships with your patients or their families. So you have to be able to engage. I think case management, a lot of it is you're a duck. You look calm on the surface and you're paddling madly underneath. But that's also one of the special challenges about case management.
There are a lot of different paths for social work. Social work can do a number of different things. I would just tell somebody to explore different options, find some volunteer work, see where their passion really is. Some people come in knowing they want to work with kids. Some people don't want to work with kids. There's mental health, there's substance abuse, there's so many different things. And the hospital actually incorporates all of that. You get to see a little aspect of each of it. And that's another thing I really enjoy about working here.
So my favorite thing about working at Hendrick is the environment, and in my position I've been able to meet different people on each floor, and so just being welcomed by them and the management team that I have, they're very supportive and have been able to help me in my career and my job here at Hendrick.
There is a level of excellence at Hendrick that is becoming more and more rare, I think, in our society. And Hendrick still wants to do the best that it can. It educates its nurses, it educates its staff. We stay on the cutting edge of things in order to provide the best for our patients and their families. And that is the most unique thing to me about Hendrick.
I've worked a lot of places, and this is one of the few places I've worked where the patient really does come first, and you're allowed to really be a nurse and take care of your patient. For
someone interested in applying here as a social worker, I think it's it's a great team working and collaborating with also just the case managers and the team, and assuring that we're able to get the job done together. And so we brainstorm off each other if we can't figure something out, and just having the managers to help us also if we're ever in a bind.
Just don't be afraid to dive in. Just go try. It's a great challenge.